It's okay.
All right.
Okay,
Well,
it's going out now, so.
thank you, Rob. I appreciate that.
Yeah.
Welcome, everybody. We're really excited. This is really special for us at VCS. We are really a bunch of kind of small animal practitioners that have kind of gotten this organization together. And we didn't want to leave out large animals because we love them dearly and we know the importance of treating them the same way we do with small animals. We just don't have the expertise at the level of our panelists. And so we're just beyond grateful and thankful for our group of panelists to come on and share their experience of using cannabinoids in horses and other large animals. This is just such an honor to have them all as part of this this coffee chat. This is our first quarterly coffee chat of 2023, and so it's pretty cool to lead it off with a large animal topic like this. And I will say, from my from my point of view, I'm beyond excited to learn about it because I get questions all the time. I just had someone ask the other day if I could treat a llama. And I was like, God, if I knew more about how to treat llamas or even horses, that would help, right? So I can't wait to learn from you all and really appreciate all of your time. And so the way this coffee chat is really set up is it's super informal. We just, we open up questions to the audience. They can actually comment on things. And it really is just a group of really interested participants. There's 22 that have joined thus far, and there'll probably be more that will join as well. And the way we're setting this one up, just because there's so many of you all with the expertise, is Dr. Silver will be the moderator. And thank you to Dr. Silver for doing that. He has a significant amount of experience too, with research and so forth, and horses and cannabis. And so it was such a nice match to have him moderate, and he's got a list of some questions. We'll start with him doing some questions. But if you have questions in the audience as he's asking further questions, please just raise your hand. There's a raise your hand feature at the bottom. Feel free to raise your hand, and then we can call on you and you can ask the panelists questions directly. Make sure, just for housekeeping stuff, make sure everyone is on mute while someone else is talking so we don't have background noises. Otherwise, feel free to unmute yourself when you're ready to ask a question. So I apologize, I have a cold, so I'm a little bit stuffy here. I'm going to go ahead and actually introduce all of our lovely moderator and all of our panelists, just to kind of, I had to shorten a little of the bios just with time, but I want to introduce everyone so everyone can kind of meet the panelists. So I'll start with Dr. Robert Silver. He is a 1982 graduate of Colorado State University. He received his master's degree in cardiopulmonary physiology. He's currently an adjunct faculty at both the Chi University and Lincoln Memorial University. Dr. Silver is an author of the popular book, Medical Marijuana and Your Pet, with a second book soon to be published. He has written numerous articles on veterinary cannabis, including 4 textbook chapters. And he is currently the president of the American College of Veterinary Botanical Medicine and past president of the Veterinary Botanical Medical Association. He has served on the board of directors of the American Holistic Veterinary Medical Association and with the Hemp Feed Coalition, and has served as a chief medical officer for several product companies. Thank you, Dr. Silver. And then I have Dr. Joyce Harmon. Dr. Joyce Harmon graduated in 1984 from Virginia, Maryland Regional College of Veterinary Medicine, then completed her membership exam in the Royal College of Veterinary Surgeons in 1985. She's certified in veterinary acupuncture and veterinary chiropractics. She's completed advanced training in homeopathy and herbal medicine and is working on a master's degree in Chinese medicine. She has published over 60 articles in the professional journals, textbooks, and magazines. She is the author of 2-volume series on saddle fitting and manual for homeopathy in horses. She is a past president of both the American Holistic Veterinary Medical Association and the Veterinary Botanical Medicine Association. She was the chairman of the Alternative Medicine Committee for the American Association of Equine Practitioners when that organization created their first set of guidelines. She was also a member of the Task Force on Alternative Medicine for the American Veterinary Medical Association. So it looks like, Joyce, you've really not done much with your career. The next doctor I'll present is Dr. Sarah Urban. Dr. Urban is a 2012 graduate from Oklahoma State University. She's a certified canine rehab practitioner and certified in mixed animal acupuncture from the Chi Institute and duly certified in veterinary spinal manipulation therapy. She's also a member of the College of Animal Chiropractor. She is currently working on a Master's of Science in Integrative Veterinary Medicine from the Chi Institute. Her special interest includes canine and equine sport medicine, nutrition, applied kinesiology, and integrative cancer therapies. That's great. And then Dr. Chelsea Ludicky attended Colorado State University for her bachelor's, master's, and doctorate of veterinary medicine. During her time at CSU, she was actively involved in equine studies at the Orthopedic Research Center, which led her to interest in equine sports medicine. She then completed a one-year internship at Piedmont Equine Practice in the Plains, Virginia, where she built a strong foundation in equine lameness diagnostics and therapeutics. Dr. Ludicky continues to add her knowledge of equine performance horses with advanced imaging courses and continuing education. She now owns her own equine practice with her husband. She is acupuncture certified and loves treating a range of patients through holistic approaches. She founded VetCS in 2017 with her partner Trish to provide a trusted and innovative source for cannabinoids in the veterinary space. And they do have horse products as well. Trish Wilhelm obtained her registered veterinary technician degree from Bell Ray Institute in Denver, Colorado. She completed her internship in Elizabeth, Colorado at an equine ambulatory practice. She went on to work for two busy equine practices as an accomplished veterinary technician, an equine ambulatory and surgical services, a patient care coordinator, and also had other experience in small animal clinics and shelters. Trish started VetCS in 2018 with Dr. Ludicky and has been instrumental in developing dosing protocols, product development, veterinarian support, and client cannabis consultations. She has spent the last 6 years specializing in the cannabis space and gained valuable experience and insight into the cannabis industry. And so, Trish, thank you for representing the veterinary technicians in this panel. It's super, super awesome to have you as part of this panel. And lastly, but not least, is Dr. Sandra Bruckner. She studied veterinary medicine at the VetSuez, I don't know how to say that, so you're going to have to correct me, Sandra, department in Bern, and graduated in 2008. She received her specialist certification in nutrition in 2018. Since setting up her cannabis and nutrition counseling practice in vet nutrition in Switzerland, she has seen many four-legged patients benefiting from cannabis. She is sought after speaker on the topic of nutrition and at various international events. So, Sandra, thank you for making the time, coming from Switzerland and being on the call, because I know the time is difficult with that time change. So thank you. So why don't I'll pass it over to you, Rob, and you can start asking some questions. And I'm here. If I see anyone asking questions from the audience, I may interrupt you. So off you go. Thank you guys so much.
Great. And thank you, Trina, for organizing this. And personally, I think I'd like to see the questions real time versus waiting until the end. And if things come up while I'm asking my so-called prepared questions, which really are just a few notes I jotted down, please feel free to raise your hand. I also wanted to say that your introduction of Dr. Ludicky was incomplete. She's the author of a great chapter in this book, on equine cannabis, and for all persons here, I would strongly suggest you pick this book up and memorize her chapter, because it's excellent. Thank you, Chelsea, for doing that.
Of course.
So I want to start with some basic things. And, when we think about a huge, 1,200-pound horse, I personally get a little nervous thinking about them getting some THC into their system. So maybe I just don't have enough experience with them to know how to do that. But just the first basic question is, if you're looking at recommending a type of product, what are your preferences? Would it be full spectrum, broad spectrum, or isolate for the equine? And why would you make those choices? And I'll just leave this open to our panel to respond.
Yeah, I'll jump in. First, I like isolate products when I've got just a plain anxiety case, horse is nervous for the farrier, doesn't want to stand still, needs something to train through its sessions, groundwork or ridden work. And then I'm not worried about ataxia or any sensitivity to THC, because those horses are generally doing something and moving. The cases where I reach for full spectrum, I've been astounded at results using full spectrum on laminitic horses, and even post-op, some of the arthroscopies post-op to try to wean the horses down off NSAIDs is being able to use a little bit of that. But those horses are in basically stall rest or, very highly managed situations where you wouldn't have rider safety be a concern, anything like that. But what I found is that just that little bit of THC, usually about 0.2, 2% in our pellets or even our broad spectrum paste can help bring down the total necessary cannabinoid content and make it a little more cost friendly for those owners.
Okay, thank you. I noticed that you in your chapter you suggest a dosage of 0.2 of a mg per kg for anxiety. That would be for the isolate then?
Just isolate, yeah.
Yeah. Now they say that isolate, because it doesn't have the synergy of all the other ingredients in cannabis, may actually need a higher dosage than we would find with broad spectrum or full spectrum. Have you found that to be true?
Yes, I would agree that especially if you don't have terpenes
Right.
or anything in there, that yes, you do need a higher dose. And I've been astounded at some of those anxious horses, how little it takes to get them on a CBD isolate alone, how little it takes to help them. But of course, over time, you may have to increase the dose or change things. But I feel like there's a subset of horses, I would say probably only 20 or 25% of horses that massively benefit from CBD isolate in terms of their behavior. But I think there has to be some sort of deficiency of endocannabinoids in those cases, because you can give a 3x dose to another horse and not see a bit of change, at least to us as humans.
Right. Well, we know that the dosing is actually very individual and has to do with the distribution and density of their endocannabinoid receptors, as well as what their baseline anandamide production is. So probably for a broad spectrum you would maybe dose even just 1/10 of a mg per kg would you for anxiety, especially if there were some nice terpenes in there. So that kind of leads me to the next question, which is that there's been several PK studies that were published, and I think you did a PK study as well, Dr. Lutke, and they all seem to indicate that the elimination phase is long enough that you probably could get away with dosing just once daily. Has that been your clinical findings as well?
Yes, I do feel ours was 5, let's see. In our higher group, it was 5, half-life was 5 plus or minus 3.7 hours. So it was variable between, again, it's that individual dosing idea, is that we had a pretty wide range. I know that the Oklahoma group found closer to 10 hours is their half-life. Clinically and anecdotally, yes, I would say once a day dosing, especially if it's, say, a rehab horse where we're trying to just keep them calm throughout the day when there's activity and horses going in and out. I like just using it in the mornings, and at night it's usually quieter for the horses. They're usually not kicking their heels up and hurting themselves at night. So I generally start with once a day. I've had a few owners come back and say that those horses do better with twice a day dosing, and that's purely anecdotal, but I think the higher the dose we go, it's been shown the slightly longer half-life and variability. So you can get it depending on what you're using. If you're using low doses, you probably do need twice a day. Like if you're doing that 0.1 mg per kg or 0.2, you probably need BID dosing.
So, and what,
I
oh, go ahead. I'm sorry, Joyce.
I have found that a lot of times I start with the twice a day dosing, and then once the response is solid, then very often once a day, or I can have the doses. For some people, it's easier, or they feel more confident if they can dose something twice a day. And so we'll just cut the dose, the actual dose they get, back down.
Okay.
And Joyce, do you use like full spec products, broad spec products, isolates? What do you tend to use? I'm just curious. And if any of the other panelists want to chime into that question, because I think it's a really interesting question that you ask, Rob.
I come from the herbalist kind of perspective. So I like to use the full spectrum that, you know, there are traces of some THC in it. I don't myself gravitate towards using isolates because to me that's extracted away from the herbal quality. But having said that, I have certainly seen animals respond when people have come to me, they're already on isolates. So it's not a bad thing. I think it's a nice personal preference, and I like that effect of the herbal, you know, the herbal broad spectrum, the terpenes, the trace of THC, to me, is what using cannabis is about.
I agree. I have made same experience that knowing in Switzerland it's absolutely forbidden to have products containing THC, so there's no question about full spectrum products. So I have the choice between broad spectrum and isolates, and I always go for broad spectrum if I could, because I also see that if I work with isolates normally, I have to go higher, and then I have to give more frequent. So twice a day instead of once a day, versus with broad spectrum, most of my equine patients really respond quite well with a single dose a day. But if I have to use isolate for X reason, normally I have to give it twice a day. So that's something that I have seen as well, that higher dosing and more often application.
And what doses do you, Sandra and Joyce, use? Are you guys using the 0.1 mg per kg dosing, or what? I'm just curious, just so we can kind of share doses with everyone.
So in anxiety, I start normally with 0.1. Yeah, absolutely. Yeah. And then normally I increase a little bit to see could we get more, because people are a bit afraid about giving a drug to the horses here in Switzerland. So we start slow and soft. And then normally you do not have to go very high in horses. I mean, that's the pretty thing. If you compare horses to canine patients, it's really a pleasure because they do not need a lot. So, yeah.
Nice. Anyone else want to chime in on what dosages they're using and which form of medication before we move on?
Hi everyone. Well, in Brazil, we are using mostly full spectrum with high levels of THC actually. So we're talking about minimum proportion of 5/1 of THC CBD. And on my experience, I so far didn't saw any kind of side effects related to the THC used in the horses. And normally I give preference to use also full spectrum products in the horses. Although when I was in my internship and having the opportunity also to use the specifically CBD, isolated CBD for intensive care horse patients. Normally I started with 0.5 milligram kilo 3 or 4 times a day, depending on the pathology and the critical state of the patient. But with the phytocomplex, the full spectrum, normally you start with a dose of 1 milligram per kilo once a day also.
Okay, thank you. Very good.
Can I just ask? Oh, go ahead, Joyce. I'll let you ask. I just wanted to ask him, thank you for chiming in from Brazil. That's awesome. I just wanted to ask, I'm just so curious, like what dose of THC are these horses getting? Like 50 milligrams, 5 milligrams? I get your ratio, but like what dose are they getting once a day or 3 times a day of THC? And then Joyce, I'll let you speak. I just got very excited about the THC part. I'm just curious. Yeah.
Yeah, of course. So that's one of the problems when we're talking about not regulated products. Because in Brazil, the production of the products, they're mostly in the hands of non-profit organizations. So many of them, for example, doesn't have the analysis of the oil. Okay, I always try to work with companies who have the analysis of the oil force. So for example, one of the products that I used to use, he used to have 17 milligrams per ml of THC.
Wow.
In a proportion of 5:1 of THC CBD, and those two being the most the principal components of the phytocomplex, and then we're gonna have also the other phytocannabinoids and terpenes, for example. Okay, and when I'm talking about the phytocomplex, I also the dose, I'm regarding the dose of the full phytocomplex, not the phytocannabinoids itself. But yeah, it's 17 milligrams per ml. Normally the level of THC that we use in Brazil, they are very rich in THC. And so far I haven't seen any kind of reactions in the horses. And actually, when we are talking specifically for pain management and inflammation management, I do need to say that the responses with full spectrum with high levels of THC are way better than we're talking about broad or even isolated products.
So how many mLs are the horses getting for each dose then? Just
So
1
for example,
ml or more?
Normally for one horse, what we do a percentage of 20% oil, the full phytocomplex of 20%. So it's like 2,000 milligrams. So normally in a 30 ml bottle. Okay, so normally I start with 0.5 milligram per kilo also. So I go with a dose, normally 1 ml twice a day. It's a good dose, and I have so very good responses. And also, as the other doctor said, sorry, I don't know her name. Normally, I also do, I may achieve a period of response where I can go backwards with my dose, and I still have the same levels of clinical responses and no actually going back in my clinical case.
That's really great. Yeah. And what we see in dogs and cats is very similar, just so everyone knows. Like for the really painful conditions, we need more THC. Like that's the CBD and the broad spec products just don't touch it the way that the THC can for the really severe cases. And certain anxiety cases, I think you need to push them with a little bit more THC. But as everyone knows, if you have the wrong anxiety case that you push with THC, you're going to make them paranoid and even more anxious and restless, right? So it's really having to read that patient and read the situation and so forth. So yeah, I think you bring up a really good point. Joyce, I know you had something to say, so I'll leave it to you. Thank you so much. Rodrigo.
I just find that horses are really sensitive. And so, I mean, I'm most of the time starting at 0.05 or 0.1 milligrams per kilogram, and seldom need to go higher. There are probably cases where, I mean, having the ability to add some THC might keep the dose low, or the clients are not willing to go to a higher dose, either due to cost or just because they're like, this isn't working well enough for me. And I think there are cases that I missed because the people are not willing to go high enough. Which I understand from both cost perspective and sometimes just the management. But horses they're good herbalists. They don't need a lot of this stuff.
So I think it's a lot of people talking about the sensibility, and one of my branches of research is actually going towards the sensibility, the higher sensibilities of phytocannabinoids with horses. And because I also work with cats and dogs, so for sure I see there's a big difference between the sensibility of the species. And we are pointing out that the biggest difference is going to be also related to the effect of the elementary state of the patient. So carnivores and herbivores, they're going to have total different responses to the product, and also preyers and predators, because of the difference in the vagal tone, can be one of them, the explanations for the higher sensibility. And we're talking about herbivores specifically. For sure, we're going to have a very good interaction within the microbiota. And then we're going to have, I think, a way more bio response, not only regarding the clinical state of the patient, but also regarding regulating the microbiota that's going to be directly connected to the healthy state of the horse.
Here
Roger,
I wanted, sorry.
I'm curious, with the amount, when you're using the higher levels of THC, not that go beyond what we call full spectrum, what sort of impact on behavior? Are they more sedated as a result of that much THC? Do they seem more activated? Or just curious about that. I've just curious. What are your
So
observations?
no, for sure. So when normally, particularly while I do, when I'm using full spectrum, specifically with high doses of THC, I do at least 15 days of desensitization. So I do 15 days of microdosing, and those 15 days of microdosing will for sure makes the total difference on my response of my patient. Specifically on horses, as you said in the beginning, it's a 500-kilo animal, so we need to be careful on that, on managing side effects or hyperactivity, or for example, pyramidal effects within the horse because of the high levels of THC. So doing always these 15 days of desensitization, I for sure never saw any kind of hyperactivity or brutal change in the behavior. Okay. What I did saw was, because all of my patients of high levels of THC, I use it for pain and inflammation. But what I did saw was a deeper level of relaxation of the animal. So we could see that, for example, the muscle face, the facial muscles and the expression, there were like expressions and postures of a more relaxed animal in that state. Okay.
So yeah, so really kind of more of a sedation. So yeah, you're building tolerance in the horse, just like we would do in a dog when we wanted to escalate the THC dosage.
For sure.
For one reason or another. That's good. That's smart. It's very smart. So that was a good question, wasn't it? So a part of that question is, once you administer the CBD, how long, what are your observations in terms of how long to onset of activity? You know, we know what the PK studies say, that it's about an hour and a half. But what are the clinical observations? And also, the second part of that question of this is do you administer it just orally, you know, sublingual? Do you give it with food? How do you administer it with food? Most of the studies seem to show that when we give it with food, we can get 4 to 8 times greater blood levels as a result. So I'm just curious what's being done out there with the equine.
For sure, if I can jump on that question.
Sure.
So I had a super nice experience when I was doing my internship in Belgium, in Bosdrift, where I have the chance exactly to do this kind of follow-up, very intense follow-up. So for example, in 100% of my cases where I start with those between 0.5 and 1 milligram per kilo, and now we're talking about isolated CBD, 30 to 40 minutes after, I saw in 100% of my cases enhance of appetite. Okay, because there were cases of critical cases that one, for example, of the symptom was a very loss of appetite. So in 30 to 40 minutes with a single dose of 0.5 to 1 milligram per kilo, I already saw very good enhances of appetite. Now, when we are talking about pain relief, I saw more and deeper pain relief matters with CBD after at least 6 hours after my second administration of 0.5 to 1 milligram per kilo. it was not. This, for example, is different when we are talking about full spectrum oil. Full spectrum oil, normally, when we are using, for example, full spectrum with intensive care, I may jump the micro dosing because it's intensive care, and I may have the structure to deal with side effects, for example. So normally with one single dose of 1 milligram per kilo with full spectrum, you can already see very nice pain relief effects. That's for sure.
Nice.
And when we're talking, and for your second part of the question, we're talking about forms of administration, etc. That was something that I really work on. And because for horses, for example, we're gonna have a very different responses regarding the ways of the administration. So for example, orally, as an oil, or as also a cream, like those anthelmintic creams, you know, that attach to the mucosa. This is very good for horses that keep their observation sublingually. Now, when we're talking about intensive care patients, what I did, because my products, they came like in capsules. So for the horses, I had to undo the capsules and do my oil or my cream, for example. So what I did for my intensive care patients, since I had to tube some of my patients, I used to put the capsule already in the tube and do like an intragastric administration. Okay, and that's for sure. I had very good results with that kind of administration, specifically for gastrointestinal inflammation.
Nice. I was involved in a study at Murray State where they compared the PK for the sublingual of the oil with pellets, and I think it's probably one of the only studies I've seen where they've actually compared those two, and they did get substantially better blood levels when it was administered with the pellets versus when it was given fasted. So I think overall, I think it seems appropriate to give it with food. It's probably a lot easier as well than just trying to put some drops
in the horse world. It's pretty much going to be given with food in the management in the chronic situation, which is probably certainly most of what I see. I don't have an acute care practice, so we're looking at horses that have long-term chronic issues. The clients are really only going to be consistent if they can give it with food. And I have found absolutely no issues clinically with an onset of seeing improvement anywhere from just a couple of days to, for some cases, 2 or 3 weeks.
Well, I think giving with food improves compliance with the small animals as well. But can we hear from some other practitioners as far as what your experiences are, so we can, get kind of a wider range of what's going on out there?
Oh, sorry, Chels.
No, you go for it. You go for it.
I apologize for my voice. I'm getting over a cold as well. But yeah, I deal a lot with our day-to-day, just regular horse owners. So I do a lot of our client consultations. So this is purely anecdotal and me talking with them every day, and what we found a lot of success in. And yes, I agree. I do reach for our full spectrum paste option when I'm starting out with something that I want to get ahead of a more severe condition. But like it's mentioned a couple times, it does get a little more cost prohibitive for your average horse owner to be able to invest in a long-term full spectrum CBD therapy plan for them. If they do need something that's, months and months, or even they're just need to be on it forever, and they do find a lot of good success with it. So Dr. Ludke and I have, we call it our Starbucks secret menu. So it's kind of in the background on our website, but we reach for it in more severe cases that we're working with veterinarians that reach out to us, or if I come across a case over the phone that just needs more support, we have just an isolate product that I work with all the time. So I'll be a little bit more of the devil's advocate on a proponent for isolate in some of these cases where we do need a higher dosing range for a long-term support option for them. So it's a 200 milligram per milliliter in an 8-ounce bottle that we have that we're able to send to owners that they can mix and feed, or or mix it with something else and syringe it in as well. And some of those laminitis cases that might need, we found even 1,000 milligrams per day to start off with. You know, I know it seems high, but it's what we titrated to in a few cases that it's where they found comfort. And then, you know, and then we lower dosing to hopefully get to a more manageable maintenance dose from there. But it kind of allows us to have this wider dosing range available to them so that it's more cost effective for the owners. So we've used that in cases to where anything from, you know, stall rest cases that are purely stall rest anxieties to we've had head shaking cases, some narcolepsy cases that we've had a lot of success with the isolate itself too. And some of those cases I'll mix in some of the full spectrum as we can. So, okay, let's use, you know, 125 milligrams a day of the full spectrum, and then we'll supplement their dosing protocol with the isolate just to get a little bit of both worlds for them and give them that extra support when they need it. So I hope that that was a lot of word.
Very helpful, Trish. Thank you.
Yeah.
It was good.
Yeah.
I have a question, if I may, Trish. That's very interesting. In the isolate world, has anyone in the group tried CBDA or CBG in connection with equines?
So we have not in equines quite yet. It's really interesting. I think I would really love to. We're working with a formulation right now for our product line for small animal for that. So we'll be getting a lot more back in the small animal space. But I'm game to try the CBDA as a proponent of it and an anti-inflammatory, you know, respective. So Chelsea,
Charles, Charles, we had partially decarbed a lot of our hemp for pellets, but it was completely anecdotal and just seeing. I felt like I got similar results in those cases, and mostly it was, you know, mild to moderate lameness cases or multi-limb lameness cases in geriatrics. So we'd love to do more research on that side. I have played around with CBG isolate and higher, just the minor cannabinoid blends with horses. I'd started using them with a lot of, or several myopathy cases, and I was underwhelmed because I kind of started thinking that would be like the bee's knees. And I just probably need to work with it more and do different dosing on it. The few horses I tried it on were either recurrent exertional rhabdos, or I had one that was an MFM case, the myofibrillar myopathy, thinking that would help quite a bit. And I think too, in terms of those are chronic conditions, like you would need daily application. And I would try them for a week or two at a time while the horse was being ridden and see if there's a difference. We didn't get an immediate response like I would expect in, you know, a canine, you know, some other breed. So, but I am interested in working with all of those. So it's good to feel the fire.
Well, we've seen, that's very interesting, because we've seen in the small animal categories, predominantly felines, that CBD sludge, excuse me, that's rich in minor cannabinoids can really make a difference in pain and inflammation, especially in canines. So it's interesting to me whether or not this molecule would do the same in the large animals, because if I had to choose, I'd actually pick that molecule over CBD.
Agreed.
Charles, I super agree. I do have some experience using isolated CBG for wounds, for control of granulation tissue in horses, and the response is super. It's actually outstanding, because it truly controls the granulation tissue and really doesn't allow to pass over their skin barrier without having to use another kind of products. This is super nice, doing like an emulsion of the crystals of CBG for applying in the wound, directly in the granulation tissue. And after it's a little bit empirical, but I do think that also does have a little bit effects of bacteriostatic control, because in the wounds that I used the CBD isolated CBG crystals with emulsions, I did not have any source of infections or necrotic tissues, and that using only the CBG emulsion without using other type of cream with antibiotics or corticoids or whatever. And also in Charles, you said about the felines, for sure. I super agree with the responses of cats for CBG. Now here in the University of Bologna, we are launching a clinical study for studying the responses of gingivitis, stomatitis of cats with the therapy of particular CBG, CBDA, and CBN complex. So because we did some researches about receptors in the cats with the pathology, and we have some very good molecular basis to find that these molecules would be more potential therapeutic than, for example, CBD in those kinds of inflammation.
Fantastic.
So I'd like to comment, if I may. I worked with a Montana hemp company, and they did absolutely no heating of their raw materials, and they pelleted them and have been selling them nationally. When I was with them, we went and presented them to Monty Roberts, who tried them out on a bunch of his horses, and he was totally bowled over at how much better the CBDA pellets worked. And these would be basically full spectrum, because there was nothing done to it, but because it was hemp, it was really, really low THC. So the CBDA, I think, is very powerful as an anti-inflammatory and as a pain medicine. Some of the benchtop studies show us that it's far more COX-2 inhibiting than CBD is, comparable to CBG actually in its COX-2 inhibition. The biggest downside to the acidics, and they're actually more absorbable than the neutrals because they have that acid group on them, so they're not as lipophilic. The biggest downside is their taste. And for someone who formulates products, which is kind of my wheelhouse these days, trying to figure out how you can get around that taste, because compliance is everything with our patients, has been a challenge. If you look at Elevet Sciences that does a 50-50 CBD, CBDA, and I heard on good authority that originally it was a mistake, that they didn't fully decarboxylate it, and they wound up with that 50-50, and they said, well, let's go with it. And it was one of those lucky things that wound up being the right thing for them to do. But they've struggled over the years trying to get it to be more palatable. They've got a paste for cats. I'm not sure how well that works, maybe for some cats, but I think soft gels is probably the best format for these, or in the native plant. I think in the native plant, there is no palatability issues at all for these pellets in the horses. But that's a very good point, Charles. And I think we're just at the gateway of really exploring the minors and the acidics in terms of the value they can bring. Everybody's been so focused on the CBD and the THC, and it's time to move on and look at the rest of the plant, Anyway, that was a great conversation. We're up to question 2 now. And then question 3 has been kind of answered a little bit, but I'd like to hear more directly, which is, we discussed that we're going to use a low dosage for anxiety. And we know there's kind of a U-shaped curve when it comes to dosing CBD, but for more painful conditions like laminitis, or for neurodegenerative conditions, what sort of, I'm sure that the dosage needs to be escalated. How high are we seeing? I saw the 1,000 milligrams, which would be basically about half a milligram per kilogram, milligram per pound, I guess, or that's pretty high dosing. Also, any side effects we see, in dogs and cats with high doses of CBD, we will see some diarrhea. Any because there seems to be a promotility effect for CBD. Are you seeing any of that in the equine as well, with higher doses? And I'll just throw it out there. Anybody wants to answer that, please?
Yeah, I have in a couple of my own patients, so that I have true follow-ups and involvement in the cases. I've gone up to actually 5 mg per kg twice a day. And those are very dramatic cases that are like, one was rotating through its soul. And if, of course, it's in combination with derotation and mechanical changes on the horse, as well as, hormonal control and endocrine testing. But I did find in those cases that we were, you have this time point in which you're changing mechanics on the horse. We were able to use a lot less NSAIDs. And of course they're on gabapentin, they're on a combination of different things, but in those horses, I feel comfortable. There was no changes in GI function. So as a prokinetic, I haven't seen that in horses, even up to pretty high doses. We've done, I don't have a lot of bovine work. We've done some zoo med work, and even at higher doses, we've had a camel. I'm trying to think of the other, a lot of just like goats and sheep and ruminants, small ruminants, I would say, and we haven't seen diarrhea in those cases. In our CSU study with pharmacokinetics and safety, there were changes in the ionized calcium ratios that did get to abnormal levels. The horses were clinically comfortable, and it was reversible at the end of the 6-week study. And we actually had ALT elevations more than we didn't have elk phos as we've seen in small animals, so it was a bit funny. But yeah, for sure anxiety, I'm not the low end of the dose for everything. So the 0.1 or 0.2 mg per kg, usually as needed. So for trailer loading, things like that. And then the range for me goes all the way up to 5 mg per kg if they need it. But in the earlier question, I do feel comfortable with really the horse stabilizing by dose 2 or 3 to see what their effect is. And if, generally it will change doses at 2-day intervals. If the horse isn't quite there on an analgesic ratio, I'll keep titrating up.
So you'll see results that quickly, that you don't need to build a steady state over a week to 10 days or so.
I mean, I think by the studies, they're still they're still getting to that steady state, but for transmucosal, when we're using this oil on high doses, I mean, the owners are seeing changes within an hour, and I was, I was present for a lot of those. At the high doses. So I think it changes things when you're at that high of a dose.
Well, that's great to know. That's good to know.
This is very interesting because I think when we're talking about therapy with phytocannabinoids, we are gonna actually arrive in a point where we're gonna do a lot of more personalized therapies. Because, for example, the responses of the doses of the phytocannabinoids is going to be directly also affected by the clinical state of the patient, and also by the age and by the pathology. Because, for example, in a recent case report, I started for a mare with chronic cry biting and white sucking. We started with a dose of isolated CBD, a very, very low dose with 0.5 milligram per kilo of isolated CBD. The mare was chronically dehydrated and a body score of 2/5 AAP. And after 4 to 6 hours of the first dose of 0.5 milligram per kilo, the mare actually developed a little bit of over-exaggerated appetite, overstimulated appetite for the next 12 hours. So we had to control a little bit the food the hay administration for the mare, and a little bit in source of having a little bit of afraid of infection or anything like that, because it was a 22 years old mare. With a clinical state of a little bit, let's say, down clinical state. So I did have this only side effect with a low dose, not with a high dose of CBD. Okay, and that's I will blame for, not blame, but go into the direction for sure. First of all, it was a sick patient, so we need to look at the endocannabinoid system of that mare, specifically when we're talking about appetite and also neurological system is going to be deregulated. So we're going to have a lot of upregulation of receptors. So I think that may be one of the reasons why we're going to have, even with very, very low doses, we may have some over responses or side effect responses.
Interesting.
I can agree that I do not really have seen side effects in horses at all. Usually I work with sublingual application of oils with quite moderate dosing and quite fast efficiency in horses. So I agree with you have been saying, Chelsea, you can stay with the owners, and even in geriatric or old horses with some moderate or mild osteoarthritis, you can really see 14 minutes after some changes, how the horse is moving. Also in anxiety, if you have dentists coming, we have some patients that are giving maybe an hour before some CBD oil just to calm down the horse. You really can watch. And normally I recognize that I'm dosing quite lower than you are doing with products that are containing THC, because I do have only broad spectrum products without THC, and I'm moving between 0.25, 0.5 milligram per kilogram, which is really not a high dosage, having really brilliant efficiency. And regarding side effects, I'm working with all species, and horses are brilliant because I've never seen side effects. And regarding diarrhea, I have clients that are suffering from fecal water. I don't know if you say this in English as well. And it helps. Even with fecal water, it was a side effect that it gets better, because when I put it on CBD because of some osteoarthritis issues, and then at the end of the day, it helped as well with fecal water. So it's even better than in canine and feline patients, I think. Yeah.
Wow. Nice. Thank you, Sandra.
Yeah, so a lot of my background, can you hear me there? Oh, it's Sarah.
Oh,
Hey, good. Okay. I work with a lot of off the track racehorses, rescue horses, and work closely with the therapeutic riding center. So I'm dealing with a lot of emotional issues with these horses coming through. So I have had, in my experience, just offering them, I do a little bit more of that background with using herbs and just offering it and seeing how much they are taking up, because sometimes it's very difficult for me to start work or energy work or chiropractic acupuncture if they're not very open and willing and receptive to things. So I have just, in my experience, offered it, and then the horse, you can kind of see them evaluate the situation and then calm. But then I also have found if the horse is starting to be nudgy with me or insistent, and I offer it again, they just will want to keep taking up the oil. And I haven't seen any negative effects from that. And it seems like a lot of the farms I go to, if the horse ends up with full spectrum on board, they end up just giving it to the goats or the sheep or whoever. So I've had some great experiences with a lot of post-tetanus issues with some goats, and then they're ending up hopping all around the farm and getting up on the doghouse again. And so really great effects on that side.
I can chime in that we've treated Nigerian dwarf goats that are as big as 120 pounds. I don't know if that's a dwarf. I raised goats as a kid and I've never encountered that breed, but at the end of the day, they tolerate THC very well, up to 18 milligrams per ml. And the anecdotal evidence is they're happy. I've seen videos of the goats who were previously a bit lame, now jumping around and doing what goats do best.
I did a bunch of sheep that had been traumatized by a coyote attack, and the whole herd was really difficult to manage. And so we put them on the CBD powder that I tend to use, is just pure plant material, no fillers or anything like that. And that whole herd, it took them about 3 weeks to really calm down, and we were playing around with dose and making sure that they all got it, but it turned out to be extremely effective in that herd of sheep.
Nice. Nice. Well, this is great. A lot of great anecdotal information. I'm finding it very valuable. I hope everyone else is. This has been great to get it organized, Trina. I don't know what we're going to do as far as the timing. I just was reaching out to Trina. We're having such a good.
Yeah, I would say we're happy to stay over the hour. If I mean, this conversation is so good. So whoever needs to jump off, feel free to jump off, and we're happy to go over the hour just because I think this conversation is so robust.
Okay. Okay, well then, shall I go to the next question here?
Yeah, let's do that.
Which is going to be kind of interesting because we're also talking about applications, and we've been talking about its use for anxiety and behavior. So, there's certain things like trailer loading or OCD conditions like cribbing, for instance. Curious stall, someone already mentioned stall rest. I know when I talk to trainers that it's really a good way to help keep them quiet in the stall. Training, adverse social interactions. What's the story? What are you guys using it for? What does it seem to be effective in terms of these types of more behavioral conditions?
Go, Joyce, Dr. Joyce, please.
I've had some incredible PTSD, rescue kind of horses that it completely changes their life in a fairly short period of time, and some pretty dramatic abuse cases that can just chill. They can move into their new life as completely different animals.
Nice.
And those are some of the most dramatic. I mean, lots of your kind of general anxiety and upset, but the PTSD rescue cases are amazing.
Thanks, Joyce. Rodrigo, cheers.
Yes, yeah, I need just, in my opinion, for when I'm talking about behavior disorders, I think for the phytocannabinoids for horses are gonna come as a water divisor, because the response it's very incredible, and as Dr. Joyce said, it's a life-changing responses for many behavior disorders. We do need to be very cautious because the baseline of the behavior disorder also maybe, for example, chronic pain, stomach chronic pain, for example. So I had a case of cribbing that the actual case baseline of the cribbing was a severe chronic stomach ache. And when we got to treat not only the inflammation, but also the pain, and of course, relieving also the anxiety, the horse was in a week, basically not repeating anymore the behavior disorders. And it's very drastically the response of the patients in the overall aspect of the patient itself. So for example, for chronic cribbing horses, specifically those in my patients, those horses that was to be like sport horses, and now they are like retired and with social and space restrictions. The full spectrum and the CBD molecule, they're gonna, at least in my experience, provide basically a very similar response, and they're gonna change they're gonna change the perspective of the horse about life, I think, because it truly changed the behavior, the appetite, the coat quality, and the behavior disorder, for example, we can diminish the practice of the behavior in more than 90 to 95%. So it's very it's incredible for me, at least.
One of the really interesting things that seems to be quite responsive are the head shakers.
Yes.
And I'm having some really good successes with head shakers.
Yes, that's for sure. That's 100% for sure. Actually, here in the department, me and Dr. Chiacchetti, we are doing a molecular research in trigeminal ganglia for specifically head shaking with trigeminal ganglia bases, and we are actually discovering that we do have upregulation of cannabinoid receptors in the trigeminal ganglia with horses for head shaking, which may explain the super good therapeutic responses and treatment when talking about head shaking.
Wow.
Mm-hmm.
Wow.
Yeah, I heard a human herbalist talking about trigeminal neuralgia in humans, and that was quite a few years ago, and that led me to trying it. And
yes,
to be working for people as well.
Yes, exactly. I just saw you perfect said, Dr. Joyce. I just saw actually a paper talking about trigeminal degeneration in humans, and it seems that CBD itself, it's going to be a very drastic change in how they treat humans for that also.
So what has been any use for it with facial nerve paralysis or facial neuritis, facial nerve issues? If it worked with trigeminal, wonder if it might for that.
Yes. Yes, exactly. In facial paralysis, I had like my personal experience actually.
Yeah.
That I had a half facial paralysis some months ago, and I treated only and completely with phytocannabinoids, and I had an improvement. Yes, I have a very good improvement in a very short period compared with I was expecting actually.
Crazy. That's great. Yeah. Thank you. Your input's so valuable here.
Thank you.
How are we doing? How's everybody doing on time? This is great. Why don't we try to wrap it up maybe at around in about 10 minutes or so?
Super.
Just I'm sure we all have many things to do. What about internal medicine complaints? You know, Cushing's, metabolic syndrome, cancer, derm conditions, any experiences you'd like to share with us? Anyone here?
What I'm seeing, and I have a lot of the laminitis, Cushing's, PPID is a better word for it. To me, so far, it seems to be a useful adjunct, but it's not like it's not like I am able to treat the PPID horses solely with cannabinoids.
Understandable.
But a useful adjunct, because many of these horses are immune compromised, they are uncomfortable for a variety of reasons. So I think it works as an assistant. It is fabulous for the digestive tract, and like someone was saying earlier, for the fecal water, for very helpful for many of the ulcer cases, not necessarily 100% sometimes, but it takes away the stress and changes the horse's outlook about their situation, and very often makes them able to adapt, and maybe with just another herbal supplement or something for the gut. But it's really good there.
And your dosing in that regards for those would be more moderate versus not as high as for laminitis, not as low for anxiety?
Yes. Yeah, the laminitis ones, I have not gone to some of those, 1,000 milligram doses, but I could see where that could help. Sometimes it's not that helpful at the lower doses. It's helpful for the rest of the body, but it's not a high enough dose for the laminitis itself.
I have a question for the panelist. And of course, I'm going to ask this question as the oncologist in the room, is any success stories or with either oral or topical application for cancer cases in large animals?
I don't honestly see a huge number. If I do have a cancer case, I always put them on CBD, and I also put them on a bunch of other herbs. So I cannot say, because cancer is so much less common in the horses, and I don't have the experience.
So with cancer, I need to say that I did use high concentrated creams as associated to stabilize and treat sarcoids and melanomas prior surgery. So there were like malformations that were like pretty much inflamed. They were very, very inflamed. And so we were trying to stabilize a little bit and reduce a little bit the inflammation prior to the surgery. And I did use almost like the resin of full spectrum cannabis directly in the application, directly in the information. And I need to say that did reduce very much the edema and the inflammation for the surgery. So as a pre-surgical topic treatment may be an option, I think.
I was thinking it, that's really, that's really interesting. I mean, I think it makes sense, right? It should reduce some of the peri-tumor inflammation, right? I mean, that makes sense from kind of mechanism. I was thinking for squames, like I'm wondering topical application of the right cannabinoids would work really well for squamous cell carcinomas in horses. I think melanoma too, again, the right cannabinoid blend might be very interesting based off of some of the research that's come out from some of the in vitro and preclinical studies on both of those tumors. But my gut is pushing me more towards squame for these horses and topical application. Even if you had something, and Rob, this is kind of your jam, is like, you put it in something that increases bioavailability and get the right blend of cannabinoids. I actually think it could be really helpful because we see some of the squames in dogs respond. If I could get a cat with an oral squamous cell carcinoma to respond, I'd probably win the Nobel Prize. I mean, anything for a cat squamous cell carcinoma to respond would be amazing. And I've tried herbs and everything else in the world. It's just those are tough biologically. They just are different than the dog squamous cells. And I think horse squames may actually respond really well to topical. So I was just thinking about that as we're talking.
Yeah.
No, makes total sense. And I need to say that the dermic the skin response of horses, it's super amazing. I said before, to control granulation tissue, it's unbelievable. The response really control the inflammation, the overgrowth of the tissue, and not only that, but it really helps also in the contraction of the tissue during the cicatrization phase. So it reduces a lot the prurito of the for the patient.
Nice.
I will say I had a squamous cell POA, so Pony of Americas. This is a couple of years ago. Now we use conjunction of herbs and oral full spectrum, and I do have it documented where we noticed I wasn't using anything topical, but just orally that it had a few squamous cell lesions around the base of the tail, but we had one in the sinus cavity. And was full scoped, worked up. Owner used to live in Florida, come back up to PA and then go back and forth with his horse. And I would say after about 2 months, owner was really concerned because the horse was blowing chunks of like snot and tissue out of its left nostril. And we were concerned that it was spreading, but the horse was still eating, drinking, actually was eating better, which I feel like the full spectrum hemp extract helped. We had that horse got rescoped and the tumor was breaking apart.
That's great.
So wow. The POA passed, the pony ended up passing away, not from squamous cell. It had just underlying liver inflammation that they had tracked until it got to me. But it outlived its son. I think it lived to like 36. So did really well. But yeah.
Oh, that's really awesome. Could I, and then I just have one last question, and then I don't know, Rob, if you have anything else, because we only have a few more minutes.
I was going to close it out after your question anyway.
Okay, perfect. What percentage of horses do you think get really the munchies with full spectrum? I mean, this is something that we get asked on small animals all the time, and it's a pretty small percentage. I think cats probably more than dogs, but still nothing compared to humans. So this is just like an odd question, but I am curious. In horses, what do you guys see based off of Sarah, your last response?
I don't think that I've seen any that I could specifically say got the munchies. Some of them eat better, but the pigs are still pigs, and the horses that feel better, they're eating because they feel better.
Right.
horses are kind of made to eat all the time anyway.
Mhm.
Yeah.
Yep, I echo that. We definitely see some that would have started out with a decreased appetite, but then they're just back to their normal. But
Esatto.
like Harmon said, the pigs are back to being pigs, and it's pretty baseline that way. So.
Mhm.
Yeah, I also agree. Exato, when you give a comfort and relaxation to the horse, it's gonna be back to the normal of eating. The only case that I did had a very over exaggerated appetite was the case of the chronic of 22 mare crybing. That in that case she did had a little overreacting appetite, eating everything a little bit in the box for the first 6 to 8 hours.
I mean, that makes sense. I think what you
horse-
all are saying makes sense is you're probably treating the condition, the nausea, the pain, whatever it is that's creating them to eat, which I think we see in dogs and cats as well. But some of them will literally just also have overeating, right? It's exactly what they'll say. What did you do? And I'm like, hey, your dog's feeling better. Why are you complaining? You know, but that is one of the things that they talk about.
Yeah.
I mean, Rob, is there anything you want to say, or do you want me to just wrap it up?
No, I think that we've covered the questions. This has been awesome. And why don't you wrap it up, Trina?
All right. Well, Rob, thank you for being the best moderator and really asking awesome questions. I mean, it just brings such an interest, I think, for the audience in this topic, because a lot of times people aren't talking about horses to this level, and to get all of your expertise, to share your anecdotal experience, your research experience, all of it has just been so wonderful. So thank you, each one of you, for taking your time. Especially, we have, I think, 4 countries represented here, which is pretty outstanding. And that really is one of the big reasons we started VCS, right? So we can have this, global impact. And so we can really build the awareness of cannabis for all animals globally. So thank you all for being here. And we appreciate the audience members for sticking through the last 15 minutes, especially because we're over. And we're always interested in volunteers and folks that want to join committees. We are a nonprofit, obviously, so having people volunteer is a big part of what we do. So thank you all again for your time. And we look forward to our next coffee chat. We're open to other options too. We can do different topics. So feel free to write VCS and let us know what you're interested in talking about. We'll chat probably at the end of June or early July will be the next coffee chat. So thank you all for your time and sharing your knowledge, and have a wonderful, wonderful week, rest of your week.
Bye, everybody.
Thanks for putting it together.
Thank you.
for everything.
It was a pleasure.